Should I go for therapy or a psychiatric consultation? Therapy is a colloquial word that stands short for one of the many talk therapy-based processes out there in the world, including psychiatric consultations. Psychiatry is a form of talk therapy, but unlike psychotherapy or counseling, it is empowered or disempowered, depending on how you view medication, by the use of pharmaceuticals, more precisely psychopharmaceuticals, like antidepressants, anti-anxiety medications, stimulants, and mood stabilizers. Psychiatrists are medical doctors who specialize later in their education career in mental health medicine. But unlike psychologists, they have a medical bias towards seeing wellness or illness in terms of chemical balances or imbalances. To rectify this chemical imbalance, psychiatrists accompany their recommendations with the use of psychopharmaceuticals. Psychiatry is therefore fundamentally different in outlook from psychology, because it sees human happiness and suffering in terms of a narrow scientific view, what is more technically known as the positivistic view of science. In the positivistic view of human happiness, you are essentially a broken machine that needs fixing and that can be fixed. Psychology-based talk therapists do not have a medical background and are therefore more inclined to see clients holistically. We completely reject the idea of fixing a human being, and rather than seeing you through the lens of hormones, organ malfunctions, chemical imbalances, we see you through the lenses of resilience, social systems, thoughts and emotional processes, behaviors, and the mystery that makes you a unique being. For us psychology-based talk therapists, you are a mystery that cannot be solved or known in full, let alone fixed. Now, to make a final judgment about whether the issue you are having belongs to the world of psychiatry or psychology is basically impossible without a professional, individualized assessment, because this decision depends on so many different variables, including your belief system, the kind of medicines that are available in your country, your finances, your physiological tolerance or intolerance to certain chemicals, self-medicating habits, and many more. On a general level, however, I can say that psychiatry or medicine-based talk therapy interventions are often desirable when mental and emotional states bring about severe levels of dysfunction, such as suicidal states, severe obsessions, hallucinations, personality splits, and the like. Psychotherapy, on the other hand, is more attuned with problems that render life difficult, sometimes seemingly impossible, or generally less enjoyable and more painful, but that do not threaten the basic function of a person. Again, I want to be very cautious here in drawing a hard line around these issues, but sometimes psychological issues can degenerate, so referring a client that is receiving psychology-based talk therapy to a psychiatrist can occur when psychological interventions have failed to ameliorate the client's condition. The client's past history, genetics, and environmental conditions can all contribute to this degeneration, and the use of medicine can sometimes offset, at least temporarily, the parameters that the clients cannot control as yet. Medications, however, almost always bring in a new level of complexity because of the dependency that can occur towards these medicines. In other words, clients of psychology-based talk therapies may end up needing medical support, and this is where a psychologist or a counselor like me will generally refer you to a trusted psychiatrist. But as a psychologist-based therapist, I am going to try to tap into your natural psychological, social, biological resources before any such recommendations are made. I am personally neither in favor or against the use of medication, and I base my recommendations on a case-by-case basis. In my experience with clients from all different parts of the world, however, I have noticed that the use of medication is often related to cultural and economic upbringing, and so I often want to discuss the way in which your culture and economic background is influencing your views of the issue and solutions that you're having. In either case, I respect the wish of the client, seeing medication as that which the client decides is needed or not needed at present to feel better, and I accompany them in navigating all the complexity they are presenting to me.